everyone, hope you've had a healthy start to 2022 and thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira Daron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. What a week. Case numbers are hitting pandemic record highs. And because so many people are doing home testing or can't find testing at all, the case numbers we're seeing are probably an extreme underestimate of the reality. The CDC is now estimating that 95% of new infections are due to the highly contagious Omicron variant. Hospitalizations are up, but there's an increasing push to try to understand what proportion of hospitalized patients are there due to COVID or just happen to have COVID and are there due to something else. But it's not as easy as you would think to obtain those data accurately. The CDC officially decreased isolation time for those who have COVID from 10 days to 5 days. And there's been a lot of controversy over whether they should be requiring a test before leaving isolation early. I say no, and the way they've written it, they really give people the option to decide for themselves. The FDA approved boosters for children ages 12 to 15, but we're waiting for the CDC's advisory committee to make their recommendation. And third doses for severely immunocompromised children 5 and older are now recommended. Our first question is from Barbara from Somerville. I was wondering if you could talk about the possible long COVID effects of Omicron. I am hoping it is no worse than a cold, but it seems that the question of what Omicron can do to you in the long term is undetermined. One of the things that makes long COVID still so mysterious and scary is that we lump 3 different clinical entities together when we use that phrase, long COVID. The first one is people who are severely ill in an ICU who had significant tissue damage and then have long-standing disability. That's something that's not actually unique to COVID. The second one is people that might not have been hospitalized but had significant respiratory symptoms that take a while to resolve. And that's something that is common with other respiratory viruses, including the flu. But then there's the more vague symptoms like brain fog and strange neurological manifestations that can follow even a mild case of COVID and which scientists really still don't understand. The other thing to know is that many of the studies that have estimated what proportion of people have long COVID after COVID have not been really well done in that they haven't used a COVID negative control group. And when they do, they always find a lower rate of long COVID than the studies that simply ask people who've had COVID whether they have any remaining symptoms. All that being said, Omicron hasn't been around long enough to know if it's going to be associated with long COVID. But when studies are done with Omicron, I urge you to focus on the ones that use a control group without COVID as a comparator. Our next question comes from Sarah from Plainville. I tested positive for COVID-19 in early December when I had not yet been boosted. Should I still get a booster shot this winter or do I need to wait? When is the correct time to get a booster shot after having COVID? And if I had the Delta variant, am I immune from catching COVID for 90 days or could I get the Omicron variant sooner? Well, the CDC has not made a recommendation regarding the need for or the timing of boosters after breakthrough infection. Data on Omicron show that having had 2 doses of mRNA vaccine and then infection provides protection against Omicron that appears to be approximately equivalent to having 2 doses plus a booster. But we don't know for sure whether you get even more protection if you add a booster after infection. That being said, for most people, the booster is extremely safe. And if you had infection in early December, it could have been Delta. And we are seeing people get Omicron within 90 days of Delta infection. Last question comes from Maureen from New Bedford. I'm wondering if it's still safe to go out to dinner during the Omicron surge. Most restaurants require masks when walking around, but not while eating and drinking. Also wondering what type of mask is the best protection when flying. Well, Maureen, safe is a relative term. What I consider safe enough might be different from what you would consider acceptable. For me, with no underlying medical conditions and 3 vaccines, I think restaurants are safe. But that's because I'm pretty confident that although I'm likely to get Omicron anytime I'm around other people at this point, it will be like a cold or flu for me. Now, if I were unvaccinated or immunocompromised, I would not think that unmasked situations were safe right now, because even if your table is pretty well distanced, you're likely to come in contact with a lot of servers, and the rates of COVID are exceedingly high right now. What type of mask to wear, again, is dependent on just how much you do not want to get COVID. If you're ready to just get it already and be done with it, then you should wear a cloth mask. Cloth masks are not going to provide much protection against Omicron. But if you're ready to up your mask game, then what you want is a combination of good fit and good filtration. And there are a few options. An N95 is the best protection, but test it out for long periods and see if you can actually tolerate it. A KN95 is really good too and easier to wear for long periods, but there are a lot of counterfeit ones on the market and it can be hard to tell. A KF94 is a good option. Or I like a surgical mask, which has great filtration, and you can improve the fit in a variety of ways, including putting a cloth mask over it to close the gaps, or using the knot and tuck method from CDC, which you can find on YouTube. That's all the time we have for this week. You can send me your questions about the Omicron variant, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.